My name is Sridevi Rajeeve, and I'm a second-year Hematology and Medical Oncology Fellow at the Icahn School of Medicine at Mount Sinai in New York City. I am here today to discuss about an interesting project that we are doing that may have the potential of how patients with myeloma are treated in the future. Right now, patients with multiple myeloma have to go through many lines of treatment, and in this day and age, a novel therapy that has been shown to benefit patients greatly are cellular therapy, which being CAR T-cell therapy, which is chimeric antigen T-cell therapy, or bispecific antibody therapy. These therapies are patients' own T-cells or other antibodies that are infused into the patient, which can kill the myeloma cells and give the patient a durable time off from myeloma. However, when these cells are given to the patient or the treatment is given to the patient, they can elicit a massive inflammatory response in the body called cytokine release syndrome, which we abbreviate as CRS. CRS is one of the most dreaded complications which we may face from CAR T-cell therapy, which is why in this day and age, a vast majority of patients getting these therapies are monitored for 10 to 14 days in the hospital for the development of CRS, so that we as providers can identify patients developing CRS and institute early treatment and salvage them from any side effects that can occur. The project that we are doing at Mount Sinai constitutes monitoring patients for development of severe CRS through two means. One is by testing a device for remote monitoring of patients, and the other is a novel means to check for those patients who are at risk for high risk for CRS using blood samples. What I want to discuss with you today is the device aspect of the project. This device is what the Mount Sinai has partnered with a device company called Current Health, which is like the leader in healthcare monitoring devices, FDA approved and HIPAA compliant, which has been cleared by all the red tape that a hospital can ever have, and we have already piloted this device on many of our patients. This device you can think of as a glorified smartwatch which you can wear on your arm. It can measure heart rate, blood pressure, the number of steps that you do, oxygen saturation, and it is telemetrically imported into a platform which nurses and physicians have access to and can monitor at the same time. Your vital signs are captured at an every 10-minute rate, which is much more frequent than nursing recorded vital signs, which gives us, the providers, a much more frequent understanding of if you develop fever, hypotension, which is low blood pressure, or high heart rate, which are the harbingers of this syndrome called cytokine release syndrome or CRS. Our hope is that by validating this device, we can move the entire treatment of CAR T cells to the outpatient setting, in which we can send you, the patient, home with the device, and we can monitor all your vital signs from home and bring you into the hospital if needed. So we believe that this study is going to be changing the face of how patients are treated with CAR T cells or bispecific cells in the future, and have a shorter length of hospital stay for patients getting CAR T cell therapy.